At this time last year, COVID-19 was sweeping across the nation, hitting cities like New York and Seattle especially hard.
It was scary because it was something we had never seen before.
It would still be 1 month before the virus was confirmed in Louisville, but Dr. Valerie Briones-Pryor was already leading the preparations at U of L Health for its arrival.
I would wake up in the middle of the night just in a panic of, oh my gosh, what are we going to do?
On February 27th, just 5 years into her nursing career and a week before the first case in Kentucky was confirmed, Angela Lux took over as nurse manager at Seven Towers at Jewish Hospital, where the health system's intermediate COVID unit would be housed.
I remember the day that my boss called me and said that we had an outbreak in a nursing facility, a nursing home facility, and that we elected to take 50 patients.
38 of those patients were coming to Lux's 23-bed unit. It was just the first of many tough days to come, many of them filled with loss.
I've lost 47 now in 11 months. So 47 patients in 11 months. I might cry when I hit 50, but I mean, I cry every time I lose one, so.
I never had lost a patient, and now we're up over 50.
With the hospital closed to visitors for most of the pandemic, it was doctors and nurses who were at the patients' bedsides during their final moments.
We would have folks pass away, and we didn't want them to die alone, so we made sure that one of us was always there.
I remember every single person I sat in there with and held their hand while they passed away. I won't ever forget their name.
At Norton Women and Children's Hospital, ICU nurse Trip Barget is responsible for taking care of the most critical patients, most of them isolated and alone.
These people are fighting so hard, and most of them are doing exactly what we ask of them, and that loneliness and that mental aspect of this illness is so tremendous.
Barget admits there was a lot of fear that came with the unknowns of the virus, but they had to keep those hidden from patients.
You just had to be strong. You couldn't let them see that you were scared, because that would not help.
For these healthcare workers, the medicine that gets them through is the times they get to send a patient home.
Every good thing that happens, we need to focus on, because we've just had, our rough months were November, December, first half of January, and, we need good things.
And the best thing yet is the vaccine.
I get excited when I see people posting pictures on Facebook about how they got their vaccine or how their parents got their vaccine.
We feel like it's a light at the end of the tunnel. We don't know that, but we put a lot of faith in that because we feel like it's the best option right now.
I do believe there is light at the end of the tunnel. I can see a little bit of light.
So rather than focusing on the losses behind them, they're now focusing on that light ahead and a sense of hope that has been missing for too long. Drew Gardner, WLKY News.